Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad you all could be with us. Also, just tuning in through our friends at iHeartRadio and Amazon Music Podcasts. We're glad you all could join us as well. Well, among other things, September is recognized as Pulmonary Fibrosis Awareness Month. And why is that? Well, currently there are more than 250,000 Americans that are living with pulmonary fibrosis, and even with that being the case, the disease really is one of those things a lot of people don't know about. Well, to kind of change that, we're excited to say that there's an organization that's helping to raise awareness. And that organization is the Pulmonary Fibrosis Foundation. During this year, they have the theme of Growing Stronger with their awareness campaign. And here to talk to us more about it, we're excited to welcome Dr. Amy Hajari Case. She's going to share with you guys not only about what pulmonary fibrosis is, but also what you need to know about the symptoms as well as treatment. Dr. Hajari Case, thank you so much for the time. Really appreciate it.
Good morning, Cyrus. Thank you so much for having me.
Glad to do it. So first of all, for our audience that's wondering what exactly is pulmonary fibrosis, can you kind of tell our audience what it is and how it differs from other diseases?
Absolutely. So I'll break it down really simple. Pulmonary means lungs, and fibrosis is a fancy medical word we use for scarring. So pulmonary fibrosis describes a debilitating family of diseases that causes progressive damage to the lung tissue, and it can make it harder for oxygen to get through the lungs and in and out to the body. It's a little different from other things you may have heard of more commonly, like asthma or COPD or even cystic fibrosis. These affect the bronchial tubes or airways in the lungs. And what pulmonary fibrosis is an interstitial lung disease, which is the larger classification of lung problems that cause inflammation or scarring, fibrosis, in the lung tissue, that spongy part of the lung that's there to soak up oxygen.
Wow. And as I mentioned in the introduction, Dr. Hajari Case, there are more than 250,000 Americans that are living with pulmonary fibrosis, but who is most at risk for it?
Yeah, so people over 60 with a history of cigarette smoking are at highest risk for developing pulmonary fibrosis. But we know a lot about other risk factors, and some of those are family history of pulmonary fibrosis or interstitial lung disease, other exposures that may happen in the home or work environment, and autoimmune conditions. So conditions like rheumatoid arthritis or systemic sclerosis that can cause the immune system to be overactive and damage the tissues, including the lungs.
So with that being said, then, if our audience is wondering, what are some of the symptoms they should be on the lookout for then?
I am so glad you asked this because we know from a 2020 national survey that was conducted by the Pulmonary Fibrosis Foundation that 86% of Americans that responded were not aware of the symptoms of pulmonary fibrosis. The most common symptoms are persistent cough, mostly a dry cough, shortness of breath that may start kind of mild and you can write it off, not think about it, and fatigue. But these symptoms really can be seen in other illnesses. They're not very specific, and they may be mild early on. So oftentimes pulmonary fibrosis diagnosis is delayed, and it can be misdiagnosed at first as other types of problems. It's important if those symptoms persist that you talk to your doctor about them, and you may get a referral to a lung specialist or pulmonologist who's really the best person to diagnose pulmonary fibrosis using a combination of history, physical exam findings, and some specialized testing that can help look at that lung tissue.
So if they're able to have that communication with their doctor then, Dr. Hajari Case, so what are some of the treatment options that may be available for someone dealing with PF?
Yeah, pulmonary fibrosis is not curable, but early diagnosis and treatment can slow down disease progression. So supportive care treatments like supplemental oxygen, medications that manage symptoms like cough and shortness of breath can be helpful, and pulmonary rehabilitation is something that we often prescribe, which is a structured exercise program for patients with lung conditions. There are specialized anti-fibrosis medications that can slow down disease progression by about 50%. And in some cases where patients have advanced pulmonary fibrosis disease, lung transplantation is actually considered to treat them.
Wow. a lot of great information as September is recognized as Pulmonary Fibrosis Awareness Month. Here to give us some valuable information, we're excited to have Dr. Amy Hajari Case. So, Dr. Hajari Case, where can our audience go for more information to find out about pulmonary fibrosis as well as information about what the foundation is doing?
Well, so we have a really exciting bunch of events happening this month, Pulmonary Fibrosis Awareness Month. Our theme, Growing Stronger, really exemplifies the strength and advocacy, awareness, and support of our patients, our caregivers, healthcare professionals, and the Pulmonary Fibrosis Foundation. We're really active on social media, so you can follow us at any of our channels at PFFORG, and we'll be sharing 30 facts in 30 days about pulmonary fibrosis there. You can interact with us by using the Blue Up for PF hashtag and posting a selfie of yourself in blue. We've got landmarks throughout the country, including the Santa Monica Clock Tower, 140 New Montgomery, and the Hotel Del Coronado that are going to shine blue to put a spotlight on pulmonary fibrosis awareness. And we have a national virtual walk day on September 25th, where we'll have nationwide virtual walks to raise money for PF research and programs. And if you want to get more information, you can visit aboutpf.org, where you can find information about the disease process, symptoms, treatment, find support groups, educational resources, and your nearest care center network site, which in Los Angeles is at the University of California, Los Angeles, a member of that care center network, where patients can find expert care for pulmonary fibrosis and interstitial lung disease.
A lot of great information. Dr. Hajari Case, thank you so much for helping us be more informed about pulmonary fibrosis, and looking forward to having you back on the program again.
Thank you.
And we thank your audience for tuning in to another great segment of Conversations Live and our News You Can Use segment. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.